My name is Haley Kennedy, and I'm an FNP student that will be graduating in May. My research project is over first-line treatment of UTIs in females. I did a retrospective chart review of 58 charts dated from January 2020 to April 2020. The data I collected included the patient's age, antibiotic prescribed, duration, and frequency of treatment. The inclusion criteria involved women between the ages of 18 to 65 who were diagnosed with an uncomplicated UTI. Inappropriate antimicrobial use is linked to antimicrobial resistance. Antimicrobial resistance is predicted to account for 10 million deaths per year globally by 2050. 269 million antibiotics were prescribed to pharmacies for outpatient treatment in 2015. At least 30% of those antibiotics were prescribed unnecessarily, according to the CDC. Urinary tract infections are one of the most common infections in which antibiotics are used to treat. Non-pregnant women with UTI symptoms account for 8 million outpatient visits each year. Drug-resistant organisms have greatly decreased treatment options for infection globally. The best way to combat this crisis is through individual providers, communities striving for evidence-based practice. Guidelines are put into place to promote the best practice, and most uncomplicated UTIs can be treated with first-line treatment effectively. The preferred first-line treatment for uncomplicated UTIs include macrobid and Bactrim. There is little evidence that shows that Bactrim leads to antimicrobial resistance, therefore it is a good choice for first-line treatment. There are two other first-line treatments that include fosfomycin and pivmekilinum. However, fosfomycin is expensive and it is not often used, and pivmekilinum is not available in the United States. For the purpose of this study, macrobid and Bactrim will be considered the two first-line treatment choices. The purpose of this project is to determine how many females with UTIs are treated with first-line treatment in a family practice clinic. So I was hoping to determine the average of inappropriate prescribing of antibiotics for treatment of UTIs in a primary care clinic as compared to the national average of inappropriate antibiotic usage, considering evidence-based guidelines. While the 30% is considering antibiotics for all different kinds of infections, since UTIs account for about 8 million outpatient visits yearly, reduction in the inappropriate use of antibiotics for UTIs would reduce the inappropriate use overall. So my results showed that overall 50% of patients were prescribed first-line treatment and 50% were prescribed other treatment. So 50% of the antibiotics were prescribed inappropriately as compared to the national average of 30%. So there can definitely be some improvement here. The most prescribed antibiotic was Bactrim, which is one of our first-line drugs, so that is good. The next one was Cipro, followed by macrobid, and then Levaquin and Cathlex. So we are on the right track, but we definitely need more awareness. First-line treatment for UTIs is not being adequately utilized in practice, and it should be used to treat uncomplicated UTIs first. Utilization of first-line treatment of UTIs can help reduce antimicrobial resistance, and 50% of patients that presented to the clinic received an inappropriate antibiotic based on clinical guidelines. So that is inadequate. This research revealed that the percentage of inappropriate antibiotic use for UTIs, however, if the rate of inappropriate use of antibiotics for UTIs can be reduced, then the national percentage of the inappropriate antibiotic use would lower as well. Thank you for your time.